Hi everyone, my name is Jeremy Train and I'm proud to be the president and CEO at ShareHouse. At ShareHouse, we believe that recovery is possible. People know us for our residential. We also provide outpatient services, standalone mental health services, standalone medication-assisted treatment services as well from our professionals, making sure that we have a holistic approach to benefiting not just the individual, but the greater communities that we serve. Several years ago, we started our walk-in assessment clinic. This provides the perfect opportunity for clients to come in when they're ready to come in. To receive much of our services, individuals first start with meeting with a licensed addiction counselor to go over an assessment process so that we make sure that we have the best diagnosis and make the best referral for level of care for them. At ShareHouse, all of our staff have a deep passion of the service that we provide to our clients. It's very evident when you first come to our walk-in clinic and you're greeted with friendly staff. They meet with a licensed addiction counselor. That licensed addiction counselor is trained to provide services that are in alignment with the American Society of Addiction Medicine. And essentially what we do is we focus on what that individual needs and we make an appropriate referral to a level of care that matches based on those issues and risks that the client presents with. Furthermore, one aspect that's unique, I believe, to ShareHouse is that we look at the motivation that the individual comes to us with, and we place them appropriately based on that level of motivation. It's really a meet them where they're at sort of thing, and it's no longer are those days that we're going to put people in a box and think that we're actually helping them. We need to get in there with them and figure it out in a team approach with that person. That's the professionalism that ShareHouse has. One of our levels of care is a residential level of care. We have treatment facilities located in Fargo and Grand Forks for residential services. At our residential levels of care, oftentimes the individual comes in and they come in at a higher level of care, they get stabilized, they learn some skills, they go through the withdrawal process, if you will, and then we move them to a lower level of care where they can go out into the community, test out their skills, and they have the ability to come back to process what it was like out there, and it was a teaching moment for those clients. We've created a treatment university for our residential services. What this is that in the morning, there's what's called the core group where all individuals can meet with their primary addiction counselor in a group setting and process any issues or risks that they might be facing or anything that they have to celebrate in their personal recovery journey. In the afternoon, there's more of an a la carte option of where there's a multitude of different groups that our individuals we serve can choose from, making sure that we bolster as much as possible the individualized care, putting them more in the driver's seat of what they want to do about their recovery. The medications prescribed by our nurse practitioners are there to help individuals with withdrawal symptoms and also any other behavioral health disorder that they might have. A number of years ago, what we started to find is that many of our clients transitioning from our residential services into our outpatient services were falling off. And to combat that, we created what we call recovery living. Essentially, it's sober living that's embedded in our residential facilities. And it makes the process to go from a residential level of care to an outpatient level of care more seamless. While in recovery living, individuals have the opportunity to practice many of their skills that they learned in a residential setting while still having a safe place to come back to in case they need it. Individuals in recovery living also have the opportunity to attend our outpatient services to help enhance their success. The aim of our outpatient services is to provide individuals who are living in the community different tools that they need for their individual care. There is a mental health component for support, case management component to make sure that they're getting their needs met, and a component of a licensed addiction counselor to come in and help educate them on the tools they need to make sure that they're staying on the right track and in recovery. One of the biggest outcries that we've identified in our community and all across the state really is the need for standalone mental health services. You hear also often of other providers having such a wait list for their therapist. And here at ShareHouse, we just recently opened up so that we have a clinical psychologist on staff to address the greater community for their mental health needs. And so individuals can come to us now that don't have a substance use disorder issue, and they can receive mental health therapy as a standalone outpatient option. Our standalone mental health services that we provide are offered in person and via telehealth, allowing for better access to individuals across the state. Working in concert with referral partners is ever so important. It's what allows us to do our mission and carry it out, all of our individual missions at ShareHouse that we have, ensuring that recovery is possible.